Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about a very important treatment for peripheral neuropathy. This is a treatment that is usually not used. This is a treatment that is usually not even talked about, and there are individuals that will never try this even though they have pretty significant peripheral neuropathy because they're worried about how strange it feels or how strange it sounds. So what I want to talk to you about is a process called release. In the past, we've talked about repair, we've talked about re-education, we've talked about reset, we've talked about repressing, all valuable treatments, all good treatments for peripheral neuropathy, but I want to talk to you about release. Basically, what this is this is giving you the power, giving your body and the mind the power to release the symptoms, to release the pain, to release the symptoms, and so the peripheral neuropathy doesn't interfere with your life. And so let me give you some examples. There is a newer concept called the pain neuromatrix, which is basically a map of pain and where it's coming from in the brain. And the thing with this pain neuromatrix is it actually helps explain how you interpret pain, how you recognize pain, and how pain affects you. And this is influenced by your environment. This is influenced by your genetics. This is influenced by the experiences you've had in the past. This is influenced by all these different things coming together so that your interpretation of pain is different than my interpretation of pain, and each individual has different situations. So if you have a persistent pain, a pain that used to be called chronic pain, we say persistent because chronic pain says you can't get better, it never goes away, where persistent pain is just pain that's you haven't found the solution for it yet. So persistent pain, and one of those causes of persistent pain is peripheral neuropathy. With persistent pain, if you're able to modify or change or treat that pain map in your brain, your pain is going to be perceived different, your pain is going to present different, and your body's going to look different. And so that's kind of what we're talking about with this release. Well, truthfully, it's exactly what we're talking about with this release. And there's several different ways of doing this. The most powerful is a process called mindfulness. Mindfulness is one of the ways that this is used is through meditation. Best example, there are monks that actually can go into meditation and they can slow their heart rate down. There's individuals that can go into meditation and get in ice cold water or swim in ice cold water and not feel it. There are individuals that they can put mindfulness into it so they're completely in control and can sit out in the snow barefoot or sit out there with normal nerves, but they're blocking those sensations. They're blocking the situation by using the power of meditation, using the power of oneness with their body, with themselves, and they're able to completely shut it down. This is a powerful tool to the point that individuals, if they're really good at meditating, can slow their heart rate down. They can lower their blood pressure. They can do all these things because of using the power of the brain to really get control of all the aspects, all the systemic things in your body. There's a nervous system in your body, the autonomic nervous system, that controls all these automatic functions of the body. But though this autonomic nervous system is controlled likewise by the brain, it's just not controlled by the conscious brain. So if you can teach yourself to use the conscious brain or even use the unconscious brain to make those modifications, you can actually get a big change, a big difference, and you will find multiple different ways that this is going to improve your life. The second in mindfulness is self-hypnosis, where you actually go into the process of visualizing and seeing what you want to do and actually helping it become a reality in your life. This is huge as well for peripheral neuropathy because you can actually start to change the way that the pain is affecting you. Again, you're modifying that map in the brain so it affects you in a different way because you change the map, and by changing the map the body goes a different direction and it does something different. This is really, really valuable if you can learn how to do this. The third one I'm going to talk about is actually a process of putting yourself into flow. Flow is a scientific process where you feel your best and you do your best. You function at the highest level, at a superhuman level or high-level athlete type situation, so you can actually function at high levels. There are individuals that will do certain activities. They go golfing, or they go surfing, or they go skiing, and they don't have any of their normal persistent pain. None of their normal symptoms of peripheral neuropathy, those symptoms are gone during those activity because they're going into flow. And so one of the ways to actually learn how to do this, to be able to flip that switch and say, I'm going to put myself into flow when I'm with my children, when I'm hiking with my grandchildren, when I'm doing an activity that I want to do, so that the symptoms of peripheral neuropathy don't interfere with your life. And by learning how to do this and say, okay, I'm going to put myself into flow multiple times a day, you can actually really get control and really figure out how to live a life that's extraordinary, even with peripheral neuropathy. And that's the purpose of release. Through this process, you can modify or change the pain neuromatrix, the brain map for pain. You can get to the point where pain is not noticed in your life because of modifying the way that your brain is perceiving it, or you can actually completely shut it down where you're not noticing it at all. So this is Dr. Brandt Gibson, and this is a powerful, powerful piece of the puzzle that I want you to have in your armamentarium. So while we're treating these in these other ways, you also have one more release that allows you to truly get a handle on peripheral neuropathy. This is Dr. Brandt Gibson. This is your Neuropathy Nugget day 328, treating peripheral neuropathy through the process of nerve release. Don't discount this. This could be very, very powerful and very helpful in your life. Thank you, and have a great